Hello everyone, I'm Dr. Anna Alder and I work at the College of Nursing as an assistant professor. I am here to talk a little bit about innovative pathways to accreditation, integrating community engaged learning and graduate nursing education. This project I've been working on with my colleague Cynthia Benyon. She's the Master of Nursing Education Program Track Director. Not able to make it today, so I'm presenting for the two of us. And this is something that we've been working on, as you can see from the timeline, a little over a year and a half ago is when we kind of started this project. This all originated when the American Association of Colleges of Nursing developed the new essentials, and that's our accrediting body. We have Domain 2, which is person-centered care. And that is something that we identified as a gap within the nursing education master's program. That those students traditionally don't have direct patient care hours built into the curriculum and into their practicums or capstones. They're working with other learners, students and new nurses. And so the question was, how are we going to capture this person-centered care domain that's being asked of us? And so we developed this 1-credit person-centered teaching course that these students now have in their program. We're piloting it now in the fall, and so far it's going well. We've got 10 students who are working directly with community partners and community sponsors and developing education for the patients that they serve. So in developing all of this, we hoped to meet the accreditation requirements. We wanted the students to be able to demonstrate this person-centered care competency. And then we also had this underlining hope that we could also address some inequity in healthcare education access and quality by partnering with communities who are traditionally underserved, vulnerable populations. That's the areas we wanted to make sure we put our efforts in developing those partnerships. So we have students currently engaging in this work. And the partners, it's a variety of health clinics who serve patients who are maybe uninsured or speak different languages. So Vamos Health Clinic, Somali Food Bank, we've got Cancer Prevention Organization, Utah School Mental Health Collaborative, kind of a variety of places where these students are assigned. They get to spend 60 hours working with their partner to mutually identify some kind of education need that those patients have, and then they get to work on the skills that they've learned in school of developing curriculum and how to deliver education in a way that's person-centered. We are at the stage now where we're doing those hours, we're going to gather data, and our plan is then to implement any feedback as we teach it again in the spring. We've got another cohort who will go through this course. And our hope with all of this is that other programs who, especially in nursing, who have to find a way to meet this domain, meet this essential, they potentially could use this as a model to follow and find a way for those students who traditionally aren't with patients. This would give them a path and a way to achieve that criteria. So, yeah, big picture you can see we've got a few different frameworks and pedagogy that we've weaved through here. We are measuring outcomes in the blue box over there. There's a few different scales and tools we're utilizing. And that's our project. It's definitely more daunting than we realized for a 1-credit class to develop those partnerships, to identify the different areas that need help, but then also in the climate we're in, how many of those partners maybe have lack of funding, resources that were cut, and how all of a sudden we need to pivot and find a different project and a different place for students to go. So it's been very insightful in a lot of ways. Any questions?
So building trust with communities is very difficult.
Yes.
How did you teach the students to do that?
Thankfully we had, and I should have mentioned this, thank you for the question. So the community engaged learning aspect of this, we worked with the Benyon Center to make this a community engaged learning accredited course. And I'm sure many of you are probably familiar with CEL courses, but that piece of it allowed us to make sure we had content that specifically spoke to how the students ethically engage with these communities, how to make sure that we're not coming in and using our biases of here's what you need to learn. It's what gaps do you see and how can I help? And I think that that's been working well. We've had introductions with myself and Cynthia with the partners and the students, and then from there the students really just start developing those relationships, and they're the ones leading the charge, and it's been pretty amazing to see. But yeah, it takes a lot of effort and time. Perfect. Oh, yeah.
What has the student response been?
So far, we're at the point where the reflections that have been coming through and the feedback we're seeing is that they're really excited. This feels like meaningful work. This is actually, for this cohort, this is the first like hands-on teaching that they've been able to do. Up to this point, it's been just their didactic, their classroom type of environments, and so this is like their first introduction to the hands-on part, and they're really excited about it. Several of the students we paired with partners that worked well with their expertise. So there's maternity, someone with maternity background, they're with a maternity clinical partner with another student who also speaks Spanish, and so the two of them together are going to be developing a workshop. So there's like different things that they do, but we've tried to make sure we're catering to their interests as well as what the needs are in the community. Yeah, a lot of excitement. So.